We know more today about what it will take to save Hennepin County Medical Center. Susan Elizabeth Littlefield has new information on what you could have to pay to keep the hospital afloat.
There's no other way to describe it as the healers.
Keeping our doors open is crucial.
And the healed.
Yeah, they saved my life.
Explain.
And we need to fight for that hospital.
But time is running short.
25 days, just in case you think I wasn't keeping track. I am. And every day becomes more important as I keep reminding everybody that we have that much time to continue to advocate. And at no point should we ever stop, because we owe no one anything but our absolute last fight for this.
The Hennepin County Commission, who took over managing the hospital in the fall, is trying to get state leaders to help with the dire financial situation.
In January, for the first time, Hennepin Healthcare cash balances were negative several days of the month.
Here's some perspective on how the hospital ended up in this situation. In 2020, they were covering about $40 million in uncompensated care. By 2024, that number had already gone to $104 million in uncompensated care. Plus a $1.7 billion cut over the next 10 years by the federal government. The commission gathered Thursday to finalize the strategy on getting lawmakers to sign on to a 1% sales tax in Hennepin County. That would mean buying a $40 dinner would now cost an extra 40 cents, and buying a $30,000 car would cost an extra $300.
But we've got to get to a point where we're bringing in dedicated revenue that sustains that hospital, because that's what keeps it open.
And lawmakers have 3.5 weeks to make that emergency safe. Do you have hope in this moment?
So I can't not have hope. And I'll tell you why. The second I lose hope is the second that I give up on that hospital, and I refuse to do that.
With photojournalist Tony Peterson, Susan Elizabeth Littlefield, WCCO News.
County leaders added they do have some hope because there is some support from state leaders in both parties.